Good evening, everyone. My name is Noah with Project Lyme, and this evening our webinar is Nutraceuticals for Treating Lyme Disease with Dr. Mariah Hinchey. She is a naturopathic physician whose career has been devoted to treatment of tick-borne disease, most notably Lyme disease. Her dedication to this area of medicine has endowed her with unparalleled knowledge and understanding of the intricacies surrounding chronic Lyme and other tick-borne diseases. Beyond this field, she's done Tau Vitality, where she's the visionary behind Lyme Core Botanicals, a distinguished herbal medicine company centered around tick-borne disease. So obviously she's an expert in the field. She has a lot to offer, and I'm gonna go ahead and turn it over to her for presentation this evening. Thank you everybody for attending.
Thank you, Noah. Thanks everyone for being here. I'm excited to be with you. Let me just share my screen. Okay, good. Okay. So I've been treating Lyme and tick-borne disease for about 17 years, I would say, over the past 7 years, really specializing in treating Lyme and tick-borne diseases using herbal medicine, functional medicine, and lifestyle medicine. So I am very, very passionate about education, and whether you're a medical practitioner or a patient, really understanding what these infections do to the body and how they make our bodies hospitable to these infections and actually hijack the immune system and get the immune system to work for them instead of us. And so, I feel very passionate about not using protocols, but really trying to marry together the mechanism of action of certain nutraceuticals and herbs, along with what is going on inside of that particular patient because of the infection. So I'm going to spend a bit of time talking about the pathophysiology of Lyme and Babesia, as well as the mechanism of action of a lot of the agents that I use to treat it. So I think it's important to note that, a lot of patients come in and they have failed months or years of other treatments. And I have patients who have been on a multitude of antibiotics without getting significantly better. I have patients who have been on treatment for months or years and get significantly better, only to relapse when they stop their treatment. And I really think that it's important to note that this is because of immune dysfunction. So again, these infections disable the immune system's ability to recognize the infection and to target it and treat it. And this leads to ongoing inflammation, which increases invasion, proliferation of the infection, as well as further immune suppression. So this turns into a vicious cycle. I think that a lot of treatments fail because the practitioner and or the patient is focused on killing the organism, not healing the patient. And, for people who are hearing me say this for the first time, that might be confusing, right? Because it's an infection and we're all taught that you need to kill an infection. You have an infection, you take an antibiotic, it gets rid of it. But really what happens is you take an antibiotic and it shrinks the load of the infection, and it takes it to a load that that particular patient's body is able to then eradicate or stop from replicating. So it's not actually the antibiotic that takes an infection to zero, it's the person's immune system. And what happens is that Lyme basically breaks the immune system so that it can no longer do this, really making the patient hospitable. So we need to figure out the root causes that are making the patient hospitable to the infection and keeping the patient from healing, and ultimately keeping the patient from being able to eliminate the infections. So we need to focus on normalizing the immune system and healing the body while we are killing the infectious organisms. So I think that this point is really worth repeating. There's no amount or combination or duration of antibiotic treatment. And when I say antibiotic, I mean pharmaceuticals as well as herbal antibiotics that are going to completely eradicate this infection. In the end, it's the immune system that has to do this. So antibiotics are powerful and they are a double-edged sword. So in addition to being very effective at eliminating infections, they also disrupt the microbiome, which is this delicate balance that we have of healthy bacteria that does a lot of really important things for our bodies and our immune system, and it can disrupt it and lead to dysbiosis. This can cause increased gut permeability, which leads to an increased toxic load, which leads to increased oxidative stress and inflammation, which can impair organs in the body, including organs of detoxification and elimination. It can also lead to an altered nutrient intake, and they can trigger the formation of persister cells. So how do we treat an infection that needs to be eliminated while restoring proper immune function? And really, I think this boils down to investigating the terrain of the individual patient in front of you and figuring out what pieces of that patient's puzzle has been altered. And a lot of time, this is going to depend on individual genetic variants. So SNPs, it's going to depend on various damage that has been done to that patient's body in the past. It's going to depend on their toxicity, their environment, their stress, what they're eating, so many different things. So we need to evaluate all of these things and figure out what is going on with that particular patient. And then we can work on restoring proper immune function while shrinking the infectious load. So when we're looking at really any tick-borne infection, it creates a perfect storm inside of the body. So in the beginning, we have this inflammatory cytokine cascade that gets kicked off, which leads to immune dysregulation. The infection stimulates enzymes that break down collagen and connective tissue in the extracellular matrix so that it can feed. It increases a chemical called galactin-3 that further leads to fibrosis and immune suppression, as well as inflammation. It damages endothelial cells. It increases intestinal permeability, increases toxicity, alters the autonomic nervous system, and a lot of times leads to dysautonomia, and again, causes formation of biofilms and persister cells. So a lot of times it's easier to think of this in this linear fashion, and we think if we can intervene at the bottom and work our way back up or even top down, that we can take this sort of one step at a time. And what I will tell you is that this is what it actually looks like. So it is a giant hornet's nest of events, and it's a very complex pathophysiological interaction where we have these upstream effects feeding all the way down, but we have these intermediates and these, end line effects that are actually causing all of these upstream effects. And it just turns into this very, very vicious cycle. So I like to call it the ball of wax. We have all of these different things making the body hospitable. So we have, again, elevated galactin-3, organ and cell damage, production of enzymes that break down collagen, inflammatory cytokines, increased intestinal permeability, dysautonomia, immune dysregulation, growth of opportunistic infections, leading to food sensitivities and leaky gut, also causing mast cell activation, digestive dysfunction, nutrient deficiencies, systemic toxicity, severe Herxheimer reactions. There's often a lot of LPS or endotoxins and mycotoxins and oxidative stress. And all of this can lead to hormone and neurotransmitter disruption. And so, unfortunately, we kind of have to tackle this all at once. And an example that I'll give you is that, we cannot get rid of these infections without healing the gut and making sure that the body is detoxifying. But we also can't heal the gut when we have infections that are causing inflammation, breaking down tight junctions and allowing toxins to enter back into systemic circulation. So it's a very complex state that the body is in, and these dysfunctions are really intermingled, but they need to be dealt with simultaneously. So I think I said this earlier, but I'll reiterate. The tick-borne diseases become chronic because they get the immune system to work for them instead of for their new host. It's also important to note that the tick saliva actually contains chemicals that ignite this inflammatory cytokine cascade and actually shifts the immune system into this confused inflammatory state. And together, these cytokines that are released from the tick saliva, as well as stimulated by the spirochete, which is the type of bacteria that Borrelia or a Lyme infection is, they work together to break down the tissues that they need to feed, which causes a lot of the symptoms. They alter the immune system and ultimately make the body hospitable. So inflammation is really the driving force. Inflammation feeds the infection. It causes a majority of the symptoms. It causes an imbalance in the immune system. It stresses and inflames the organs. It causes hormone and neurotransmitter imbalance, and it breaks down the gut lining, increases permeability, which increases toxicity and oxidative stress. So it's really inflammation that's making the body hospitable. And I want to point out that restoring gut integrity is key. If we have increased intestinal permeability and massive inflammation in the gut, we are going to be allowing pathogens, immunogenic food particles, and endotoxins back into systemic circulation. And this is going to increase inflammation as well as distract and sometimes overreact the immune system. And this is going to increase the severity of Herxheimer reactions, overburden our detox systems, and really lead to chronic central nervous system inflammation and symptoms. So I want to take a step back and really go through the pathophysiology of Borrelia, so Lyme, and how it enters the body and how it actually turns on this cytokine cascade. So in the initial stages, we have the adhesion of the spirochete to the endothelial cells on a blood vessel. Then you have these inflammatory cytokines that are released, and that loosens these endothelial cell junctions, and it allows the bacteria to enter into the extracellular matrix. And Lyme would love to live here way more than in the bloodstream because it does not like oxygen. Oxygen can kill it. So when it gets into this extracellular matrix, there's a lot less immune cells, and there's a lot more for it to eat. So I'm going to go over 3 different enzymes that Borrelia uses to actually break down the extracellular matrix and feed itself. And it's important to note that there are certain herbal medicines that can inhibit these enzymes. And if we inhibit these enzymes, we can slow the spread of this infection through the body. And we also can decrease the amount of damage that it does, and we can start to starve it. So the first enzyme is called hyaluronidase, and it is going to degrade or break down hyaluronic acid, which is a glycoaminoglycan, which is distributed throughout the connective, epithelial, and neural tissue. So we can inhibit hyaluronidase by using echinacea and ashwagandha. So using these 2 herbs will help to block this enzyme from breaking down the extracellular matrix. Agrokinase is the next enzyme, and this primarily breaks down cartilage in the joints. So we can inhibit it using Japanese knotweed. Next, we have the collagenases, or MMPs, and these do exactly what it sounds like. They break down collagen. And so we can inhibit these matrix metalloproteinases or collagenases using, again, Japanese knotweed, Chinese skullcap, red sage, and cordyceps. And again, I want to note that these inhibitors will halt the spread of the infection. If they can't break down collagen, they cannot feed, reproduce, or spread. Okay, so looking at the inflammatory cytokine cascade, it really all gets kicked off by a chemical called nuclear factor kappa beta. And nuclear factor kappa beta is stimulated by flagellin, which is an inflammatory protein located on the flagella or the tail of the spirochete. And so this is going to kick off the cytokine cascade and immune cell proliferation that further breaks down the tissues that they need to feed from. So we can inhibit nuclear factor kappa beta using a whole host of herbs that you can see here. But I want to point out that both Japanese knotweed and Chinese skullcap, two of the herbs that you saw inhibit all of those enzymes, are going to inhibit nuclear factor kappa beta as well. So next we move on to the mitogen activated protein kinases, or MAPKs. And these are also stimulated by the bacteria, and they're the primary pathway used to enter a new host. And they also stimulate part of the cytokine cascade, specifically interleukin-6, tumor necrosis factor alpha, and interleukin-1 beta. So we can inhibit these MAPKs using, again, cordyceps, kudzu, but also Chinese skullcap and Japanese knotweed. So next we have interleukin-6, which causes degeneration of neurons in both the peripheral and central nervous system. It inhibits T regulatory cell production. It drives fever and multi-organ injury. And we can inhibit it using andrographis, kudzu, red sage, and again, Chinese skullcap. Interleukin-8 is a pro-inflammatory cytokine that causes cellular damage, and it is the primary cause of inflammation in a Borrelia infection. We can inhibit it using cordyceps, N-acetylcysteine, again, Japanese knotweed, but also curcumin and quercetin. So interleukin-1 beta is the primary cytokine expressed in a Borrelia infection, and it plays a different role depending on whether we're talking about an acute infection or a chronic infection. So when we're dealing with an acute infection, it's actually crucial for the host's defense and its response to injury and infection. And so it plays actually a beneficial role in resolving acute inflammation. But once an infection becomes chronic, it's actually an amplifier of the immune reaction, and it can lead to autoimmune and autoinflammatory diseases. It also supports tumor development, growth, and metastasis. So interleukin-1 beta is definitely not something that we want to have elevated long-term. We can inhibit interleukin-1 beta using cordyceps, boneset, again, Japanese knotweed, kudzu, red sage, and Chinese skullcap. Tumor necrosis factor alpha is elevated in a lot of chronic inflammatory conditions. It causes severe brain and central nervous system damage, and it also affects the hypothalamic pituitary adrenal axis and can cause issues with appetite, body temperature, liver function, blood sugar control, and we can inhibit it using cordyceps, boneset, hatunia, Chinese skullcap, and red sage. Interferon alpha causes tissue inflammation, organ damage, autoimmune conditions, fever, fatigue, leukopenia, and depression. And we can inhibit it, again, using Japanese knotweed, red sage, and Chinese skullcap. Indoleamine 2,3-dioxygenase, or IDO, decreases T cells, so it's an immunosuppressant, and it severely decreases melatonin and serotonin by breaking down L-tryptophan into 3 counterparts. So melatonin is a hormone needed to sleep and to stay asleep. Serotonin is our happy hormone. So a lot of patients come in with insomnia, sleep disruption, depression, anxiety, and this can be one of those driving forces of it. We can inhibit IDO using, again, Chinese skullcap as well as cranium. So quin is one of these 3 breakdown products that IDO breaks L-tryptophan down into. And so quinolic acid can actually cause seizures, and the number and seriousness of seizures that people experience can be directly related to these levels. It can cause overstimulation of neurons in the brain, excitotoxicity, and degradation of brain tissue. So we can inhibit quin using Chinese cat's claw, Chinese skullcap, melatonin, and selenium. And I want to note here that Chinese skullcap contains high levels of melatonin all by itself. So Chinese skullcap is very, very helpful to use at bedtime to help sleep. And then melatonin in general is also very protective of the brain. So this ongoing inflammatory cytokine cascade leads to an imbalance in the immune system and leads to this immune dysregulation that allows this infection not only to survive in the body, but to thrive. And I want to point out that Japanese knotweed, Chinese skullcap, and ashwagandha, those 3 herbs are going to inhibit everything that we've talked about so far tonight. So it's going to inhibit the enzymes that break down the extracellular matrix, break down collagen, cartilage, and feed the infection, as well as causing a lot of joint pain, instability, dysfunction in the body. It's going to inhibit the inflammatory cytokine cascade and also balance Th1 and Th2 of the immune system. So we can do a lot with just these 3 herbs. All right, so galactin-3 is an additional upstream driver of inflammation. So quickly, it is a beta-galactoside protein. It regulates cell to cell and cell to extracellular matrix interactions, and it's produced by many, many immune cells. And in an acute infection, it plays a very important role. So it's an alarmin that basically calls in inflammatory and immune cells to either deal with an infection or heal an injury. And in a chronic infection, it's like an alarm that never turns off. And so it's going to continue to drive this inflammatory process, and it actually leads to excessive fibrosis, immune suppression, as well as inflammatory cytokine overproduction. So chronically elevated galactin-3 is going to lead to suppressed immunity, increased cytokine storms, mast cell activation, fibrotic formation. It promotes pathogen adhesion and invasion. It causes the formation of biofilms, which are the little, I would call them like fort-like structures that the bacteria can evade the immune system by hiding inside of, and it can lead to autoimmunity. So you can see here in this picture where you have the 5 little circles connected by the 5 lines. Those are called pentamers or activated galactins. And when these bind to each other and then to the branched N-glycan on the glycoproteins, it forms this lattice. And this is really like the integral structure of the biofilm. So 10 goals for successful resolution of Borrelia or Lyme disease are, I like to call them the 10 Bs. So we need to do the background check, and I'm going to get into these in more depth, but if needed, we need to use some Band-Aids. We need to block inflammation. We need to buffer the effects of stress and dysautonomia. We need to balance the immune system. We need to build the gut. We need to break down biofilms. We need to bolster detoxification. We need to bind toxins, and we need to blast the bugs. So background check. This is really just looking at your patient from a functional medicine perspective. Do they have micronutrient deficiencies? You know, I don't like to simplify our extremely intelligent bodies, but really we are a bunch of biochemical reactions. We eat something and we convert it from A to B to C to D using different enzymes. Every single enzyme is dependent on a cofactor, and these cofactors are typically vitamins or minerals. So if we have micronutrient deficiencies, we are not going to be able to make these conversions that build us structurally, you know, everything from like our skin or hair or liver cell to, you know, the chemicals that run our body, like neurotransmitters, hormones, immune cells, etc. So one thing that I do on almost every single one of my patients is a white blood cell micronutrient panel, because it just tells me black and white, what does my patient need? What are they deficient in? What are they getting adequate amounts from in their diet or from the current supplements that they're taking? We have to look at their digestion. We have to make sure that the foods that they're eating, even if they're super healthy, are not causing inflammation, histamine production, or toxicity. We need to look at their diet. We need to get them eating a high phytonutrient rich, low inflammatory, low sugar, low dairy, low gluten, low processed food diet. We need to look at their hormones. We need to look at their organs. We need to deal with their mindset and perceptions. A lot of these patients have been sick for decades. They've been told it's all in their head. You know, and they've really been dismissed by the medical community and are stuck in a very, very terrible victim role where they really do not think they're going to get better. And all of that matters. We have to get them sleeping. We have to get them dealing with stress. We need to get them moving as much as they can. And we need to make sure that they have a good community, social network, you know, healthy interpersonal relationships. And then we have to deal with mycotoxins, other biotoxins, chemicals, etc., that we are all bombarded with on a daily basis. So a lot goes into this background check, but it is super important to evaluate all of these pieces of the puzzle and really figure out what is going on in the terrain of that particular patient. And then sometimes we need to use Band-Aids. You know, I always say that I don't do Band-Aid medicine. I don't like doing it. But if someone is really, really suffering and they have zero quality of life, sometimes we need to use, you know, prescription anti-anxiety meds or antidepressants, or, you know, using something like LDN, or getting into using various herbs, you know, to treat symptoms, which again, I don't really like to do, but again, we need to get the patient to the place where they are able to function and function enough to at least be able to start making some changes and be able to do the protocol. So next would be blocking inflammation. This is a 3-part. So we need to block galactin-3 because galactin-3 suppresses immunity, increases fibrosis, increases the inflammatory cytokine cascade, makes biofilm, suppresses natural killer cells, does a whole host of things. So the best natural inhibitor of galactin-3 is a specialized form of modified citrus pectin called pectisol. We need to block the inflammatory cytokines. We can do this using the 2 herbs that I referenced earlier, Japanese knotweed and Chinese skullcap. So again, all of these inflammatory cytokines that you see listed here on this screen can be inhibited by just those 2 herbs. Then we need to block those inflammatory enzymes that break down collagen in the extracellular matrix. And again, Japanese knotweed, Chinese skullcap, and ashwagandha in combination can inhibit all 3 of these. We need to buffer the effects of stress and deal with dysautonomia. And there's so many things that you can do, you know, both therapeutically or self-care, or with various nutrition and supplementation. It's really just too much to get into for this talk, but you can see a summary on this slide as well as this one. We need to balance the immune system, balancing Th1 and Th2 using ashwagandha. Also, we can modulate the imbalanced relationship between Th1 and Th2 cytokines using astragalus. If natural killer cells are low, we can increase them using cat's claw, and we can increase lymphocytes and white blood cells in general if they're low using echinacea. So we need to build the gut. There's a lot here in this slide as well, basically using a good 4R protocol. So eliminating foods that are causing antibody production or flat out food allergies, eliminate pathogenic bacteria, yeast, mold, balance the opportunistic bacteria, replenish the healthy flora, address the gut lining, replace deficient micronutrients and or digestive enzymes. I love using pectisol for this. It helps to decrease nuclear factor kappa beta right in the tight junction area, which helps to decrease all of the other inflammatory cytokines there, helps to bind the LPS, which is the endotoxin that kicks off all of that inflammation as well and increases a HERX. Serum-derived bovine immunoglobulins are very helpful to heal the gut as well as a binder. And obviously, we need to eliminate gluten, dairy, sugar. We need to get our patients eating an anti-inflammatory, phytonutrient-rich diet. I love doing intermittent fasting with patients, just giving the digestive tract a break and allowing it to heal itself is huge, as long as the patient's adrenals are strong enough to do that. And we really need to make sure the patients are sleeping and dealing with their stress, or it's going to negatively affect the ability to heal their gut. We need to break down biofilms. Again, I love using pectisol for this. We can also use proteolytic enzymes like serrapeptase and nattokinase. And a lot of botanicals are known to break down biofilms as well, and you can see those listed here. We need to bolster detoxification. And so there's so much that goes into this, but what I will say is the most important thing is to make sure that the routes of elimination are working. We need to start there. We need to make sure that patients are pooping, peeing, breathing, sweating, right? Getting toxins out of the body. If we are so focused on getting toxins out of the cells and not focusing on where the toxins go once they're pulled out of the cells, you are going to make your patient more toxic. So we need to focus on elimination, and then take a step back and work on coordinating phase 1 and phase 2 of the liver detoxification pathways, not just using things that are going to push phase 1 or phase 2. So really, it's about balancing the two, because if you have phase 1 going faster than phase 2, you're going to have this buildup of toxic intermediates that are actually more toxic and more inflammatory than the original toxin was. And then obviously we have to make sure that we're getting the nutrients to support both the cytochrome P450 phases as well as all of the phase 2 pathways. So then we have to bind endotoxins, and we need to deal with a Herxheimer reaction. So, most people realize that a Herxheimer reaction is miserable and can make, patients really symptomatic, hiccup symptoms that they currently have. What I didn't realize for a long time is that this is actually making the patient sicker. It's not just kicking up their symptoms. So when you kill the bacteria, they release something called LPS or lipopolysaccharide, and that's the endotoxin. And that is going to stimulate nuclear factor kappa beta and this entire inflammatory cytokine cascade that we just went over. And it's going to literally increase inflammation in the body. And that is going to lead to cell damage and excess oxidative stress. And so it's important to, again, make sure that the patient is detoxing, making sure that you've addressed the gut, making sure that you are using binders. And, I'm sure that you could get 20 different people that will differ with my opinion, but I like using weak binders. I don't like using binders long-term that are going to bind nutrients. So I like using things like chlorella, like Pectisol, SBI. And again, it's because these things aren't going to bind the nutrients. So if a patient is having a terrible herx, I might have them use activated charcoal in the middle of the night away from everything else, but I'm really not going to have them take activated charcoal for more than a few days at a time. If I have a patient where we need to use binders ongoing, for weeks or months, I'm definitely going to choose something that isn't going to bind their nutrients as well. We need to focus on making the person alkaline. So a lot of times when you're herxing, you are way more acidic. So Alka-Seltzer Gold, chlorella, minerals, Celtic sea salt, all of those things can help with alkalinization, as well as adding lemon to water, things like that. And then really ramping up the anti-inflammatories, specifically N-acetylcysteine, Japanese knotweed, and Chinese skullcap. And finally, we need to blast the bugs. So there's a whole host of herbs that have been shown effective at killing Borrelia, as well as other tick-borne diseases. And I want to show you that on this list here, there's Chinese skullcap and Japanese knotweed. So not only do these two herbs do all of the things that we previously talked about, but they actually have antimicrobial effects as well. So this slide, hopefully you'll just get the gist that there have been a multitude of studies done both in vitro and in vivo showing the inhibitory effects of multiple different botanical medicine herbs. I'm just going to flip through these here. And then, of course, we have master herbalist Stephen Buhner's books, which are a wonderful, wonderful resource for all of these herbs, as well as the pathophysiology of these infections. He dedicated his life to this, and we owe him a lot. I would say close to everything I know came from that man. So I highly, highly recommend reading his books, and everything that he talks about is cited, which is amazing. Anyways, so my 7 most used antimicrobials for Borrelia are Japanese knotweed, cat's claw, Chinese skullcap, sweet Annie, cryptolepis, petunia, and black walnut. And so I have monographs in here, abbreviated monographs for all of these herbs, and I'm just going to hit the highlights for the sake of time. But really what I want to impress upon you is not only are these herbs that I'm going to go through antimicrobial, and they've been studied and proven to be antimicrobial, but they have a host of side benefits. So most of them are anti-inflammatory, immune modulating, some of them neuroprotective, and we'll start with Japanese knotweed. So it is also anti-inflammatory, it's immunomodulant and immunostimulant, and it's neuroprotective. Cat's claw is anti-inflammatory and antioxidant, in addition to being anti-spirochetal. It's also cardioprotective and immunostimulant. Chinese skullcap is antibacterial, anti-spirochetal, anti-inflammatory, neuroprotective. Sweet Annie is antibabesial and antiplasmodial. It's antibacterial and anti-spirochetal. It's anti-inflammatory, and it's also antioxidant. And then we have cryptolepis, which is antibacterial, anti-spirochetal, antimalarial, antibabesial, and anti-inflammatory. Petunia, which is antibacterial, anti-inflammatory, and antioxidant. And black walnut, which is antibacterial, anti-spirochetal, as well as anti-inflammatory. So in summary, I think it is super important to take a whole body approach. We need to focus on healing the patient by correcting the immune system dysfunction, decreasing inflammation, and ultimately making the person inhospitable to the infection. focusing on making the body inhospitable while shrinking the bacterial or parasitic load, in my opinion, gives the best chance for eradicating the infection, healing the body, and restoring proper function. So here is a summary slide that I put together for you with the 10 Bs. And I just tried to jot little reminder notes in there as far as like what nutraceutical or herbal medicine fits in where, so that you have it all on one page. I know that Noah is going to pass out to you something that's a little bit more in depth, but again, I got it on one page for you. And here is a sample herbal protocol, and this is in addition to doing all of that background work. So all of the pieces of the puzzle. So I would give a teaspoon of Pectosol 3 times a day. I would give a half a teaspoon of ashwagandha 3 times a day, a fourth of a teaspoon of Japanese knotweed 3 times a day, a fourth of a teaspoon of Chinese skullcap 3 times a day, a fourth of a teaspoon of cat's claw 3 times a day, a fourth to a half of a teaspoon of cryptolepis 3 times a day. And then I typically will use at least 3 killers, and I like using, the 3 that were in the studies. So cryptolepis, sweet annie, and black walnut. Again, it's a fourth of a teaspoon of each 3 times a day. And then I like grapefruit seed extract because it is a powerful antifungal, as well as there was a study or 2 showing that it inhibited the cyst formation of Borrelia, which can be hard to tackle. And then I would consider others depending on individual symptoms. So really quick, I want to go through the pathophysiology and treatment of Babesia. And I think it's important to note that Babesia often can be persistent. And really what I mean by this is even after successful antibiotic therapy, where a blood smear has shown to be clear of Babesia, the disease can relapse. And it typically is going to reoccur within 2 to 4 weeks after this clearing. And the thing that's really important to note is that the offspring of the previous generation that was killed typically has resistance to the pharmaceutical that was used to kill it. And this is through something called pleomorphism. And really, it's where it's able to alter its genetic structure and body shape to basically evade the mechanism of action of the drug that was used to kill it. So it's smart, it learns what killed the previous generation, and it adapts and it learns how to avoid that. Nitric oxide is our body's innate built-in ability to deal with a parasite, especially when it attaches to a red blood cell or endothelial cell of a blood vessel. And our body is going to release nitric oxide, which will basically break down and kill the bacteria. So if you or your patient is low in arginine, then it's really important to supplement with it. Now, I will not supplement with arginine if a patient is not low in it, because a lot of my patients have high viral titers of a multitude of viruses, and I don't want to push viral growth. I will often use lysine to balance the addition of arginine. But my point is that it's really important to use arginine if the patient is deficient, because you cannot make nitric oxide without arginine. Reproduction of Babesia is dependent on cyclin-dependent kinases, or CDKs. We can inhibit these using a multitude of herbs, including sweet annie, Chinese skullcap. And so in an acute Babesia cytokine cascade, we have the innate immune system increasing interleukin 12, interleukin 18. Together, they are going to stimulate natural killer cells to release interferon gamma. And interferon gamma is going to stimulate the macrophage to convert arginine into nitric oxide. And then you have this, this reaction that basically kills the bacteria. In a chronic Babesia infection, we have the B cell releasing interleukin 10 and interleukin 4. Interleukin 10 is going to stimulate transformative growth factor beta, which increases L-ornithine levels, which supports parasitic reproduction. IL-10 is also going to stimulate the release of arginase, and arginase is going to break down arginine. And now you do not have the building block of nitric oxide. IL-10 also is going to suppress IL-18 as well as IL-12, which decreases the release of interferon gamma by the natural killer cell. And that, along with the degradation of arginine, blocks nitric oxide production. So there are multiple sources that show that successful resolution of Babesia depends on four things: the spleen's production of interferon gamma, the body's ability to make nitric oxide, increasing interleukin 12, and decreasing or regulating the production of interleukin 10. So when we're looking at resolving Babesia, we need to focus on fixing the immune system, modulating the cytokine cascade, supporting the organs and protecting the organs that Babesia likes to invade, and then obviously using anti-Babesial herbs. So modulating the immune system, two favorite herbs, ashwagandha and astragalus. Decreasing IL-10 using things like Chinese skullcap and ashwagandha, suppressing IL-4 using astragalus, inhibiting TGF-beta using, again, astragalus, Chinese skullcap, artemisia, etc. Inhibiting the generation of arginase using, again, Chinese skullcap. Stimulating IL-12 using eleutherococcus and astragalus will decrease IL-10. And then stimulating interferon gamma using astragalus and or grapefruit seed extract. So I want to show you here where the herbs intervene. So when we bring in ashwagandha, it is going to block IL-10, 12, which then stimulates the natural killer cell to release interferon gamma. Also blocking IL-10 is going to block the release of arginase. We bring in red sage, which is going to increase this enzyme called inductible nitric oxide synthase. And we bring in arginine if the patient is deficient, and we are able to make nitric oxide again. If we bring in astragalus or sweet anise or red sage or Chinese skullcap, we are going to inhibit IL-4, inhibit TGF-beta, which inhibits the production of L-ornithine, which is going to inhibit or at least take away the support for parasitic reproduction. So as far as organ support goes, we need to protect the red blood cell. That's one of the most favorite places for Babesia to invade. So we can do that using Sita acuta, ginger, skullcap, sweet anise. We need to protect and increase nitric oxide levels by giving L-arginine if the patient is deficient. And we can upregulate that nitric oxide synthase and NO production using red sage. We can protect the endothelial cells using Bidens pilosa and Japanese knotweed, protect the spleen by upregulating CDK inhibition using red sage, protect the liver using milk thistle. And then we have our proven killers here. So my favorites being Cryptolepis, Alcornia, Sita acuta, Bidens pilosa, and Artemisia. And this study here done in 2021, published in Frontiers in Cellular and Infection Microbiology, demonstrated inhibitory effects against Babesia duncani using Cryptolepis, sweet anise, Chinese skullcap, Japanese knotweed, and Alcornia. And you can see here the top two performers were Chinese skullcap and Cryptolepis as far as their percent inhibition. And really, it's important to note that these herbs have a synergistic effect. So they're going to work better when used together. I would never use one or two herbs alone to try to treat any of this. So again, a sample herbal protocol, in addition to doing all of the background work, could look like Cryptolepis, Alcornia, Sita acuta, Sweet Annie, ashwagandha, red sage, L-arginine, if necessary, astragalus, and milk thistle, and you can see the doses there. So putting it all together, we need to figure out what is making the body inhospitable to the infection, bottom line. And the preliminary treatment as well as the ongoing treatment needs to be focused on that. We have to look at all of the things that are filling our patients' buckets, and we have to start to drain that bucket and get the water line to come down so that there is room for tolerance of treatment. Because when we kill these things, they're going to release their endotoxins, which is going to increase inflammation and cell damage, basically, histamine production, etc. So we need to make room before we get to that stage of killing, and we have to make sure that we are supporting all of the systems, especially the gut and the detoxification systems, while shrinking the infectious load and rebuilding the immune system. So really understanding how the infectious organism manipulates our body to make it able to thrive, understanding the terrain of the patient, what that particular patient's circumstances are that are making them hospitable, and then understanding the mechanism of actions of various medications, herbs, and nutraceuticals that you're using. And then you can create a very intelligent, effective treatment plan that consists of the least amount of things that you need to bring those effects about in the patient. So I'm not going to go through this roadmap. This is my approach to a patient. You guys can go over it on your own just for the sake of time. And that's it. Thank you.
Amazing presentation, Dr. Hinchey. I had a couple of things I wanted to relay to the audience first. I received a couple of messages asking whether or not this is being recorded. Yes, it is being recorded, and I will send an email around with a link to the video to everybody who is an attendee or has registered. I also wanted to state, as we move into the Q&A section of the evening, that Dr. Hinchey cannot take any specific questions about a patient's specific situation. That's for you and your doctor. She can answer generalized questions about the topic of the webinar, which is nutraceuticals, herbs and botanicals. So I have a couple of questions already in. I see, as I said, Q&A opening, a couple more dropping in. So I'll go ahead and start with Miss Selena. She asked, is there an advantage to leaving biofilms alone instead of breaking them down?
Well, I will answer that in two ways. So I would say in the beginning, if a patient is not detoxing appropriately, or if they're really already struggling to handle the amount of active bacteria that's already exposed, I guess I could see waiting to address the biofilms until you got to the point where a patient was substantially better, right? Or to a point where they could handle it. But if you aren't breaking down the biofilm, you're not going to get all of the bacteria. And then when you stop treatment, those active bacteria that are hanging out in the biofilm are likely to come out, and then the infection will replicate exponentially, and you will end up, going back to having your infection. So I'm not sure if that's what she's asking, but that's what my answer would be. So no, I think you do need to address the biofilms for sure. Maybe just not right away.
And to add on to that, obviously, I am not a practitioner, but from what I've heard and read, addressing the biofilms is a huge factor in diminishing your chance of having persistent Lyme, because that's one of the main reasons why it continues to persist in people. So I hope that that has answered your question, Selena. To move on, we have a Miss Parks. She said, and I'm sure you've heard this a lot, especially being in the botanical space, what if mold is involved? That is the gist of the question. I will let you do with it as you will.
So in any case, whether you're working with botanicals or pharmaceuticals or any approach, if mold is a piece of the puzzle, mold absolutely has to be addressed. I think it depends on whether or not the patient has mycotoxin illness or a mold allergy. If there's mycotoxin illness and it is causing massive inflammation and immune dysfunction and all of the other things that the tick-borne infections are already causing, it's just going to complicate matters. And, they work synergistically with each other, helping each other basically to cause issues. So yes, definitely mycotoxin illness needs to be dealt with.
The person who asked the question actually just responded in to say that they do have mycotoxin illness. So it seems like you may have hit that one right on the head. So thank you so much for your response to that. I've received a lot of questions. I do want to let everyone know it's likely that we won't get to all of them just because of time. And some of them aren't necessarily directly related to Dr. Hinchey's presentation. So just looking through here, Miss Hartman asked, is it common to struggle with the addition of Cryptolepis to a multi-herb formula?
Is it common?
That was the question. Yeah.
It can be common to struggle with the addition of any antimicrobial. With Cryptolepis in particular, Cryptolepis has been shown to address persister cells and be able to kill persister cells. So again, reading into the question. So I guess if someone is reacting to Cryptolepis, but not other antimicrobials, I could say, okay, maybe it's because it's targeting persister cells that other things have not been able to target, or with Cryptolepis also being antiplasmodial and antibabesial, is it hitting, like a different organism altogether, right? Like a parasite versus some of the other herbs that aren't parasitic. But I mean, in general, I use Cryptolepis a lot. And it might also be my approach in the stages in which I do things. But a lot of my patients really tolerate what I do.
Okay, I think I'm going to end it with 3 more questions, but I did have a quick question for you, Dr. Hinchey. It seems like a couple of these were in relation to things you've already presented on in this PowerPoint. In addition to this 10B approach, would you be willing to send your PowerPoint, or can I share it with everybody who's registered, or is that, I guess, private information?
No, I'll give you a PDF that you can distribute to everyone. That's fine.
Okay, perfect. A couple of, just for reference for everybody who's submitted questions, I think one was best supplements for Bartonella. Dr. Hinchey has addressed a couple of those things in the PowerPoint directly, so I would recommend that that we just share that around in the meantime, so I can get to a couple of these other questions. So I have from Dr. Susan Eisen. She said, first off, hi. I'm not sure, Ms. Hinchey, if you know her. I do personally. I've worked with her a couple of times. She asked if you have any recommendations for cell membrane support and mitochondrial support.
Yeah. Yes. So as far as cell membranes go, obviously looking at all of the fats. So, phosphatidylcholine, phosphatidylserine, EPA, DHA, Hopefully I don't get backlash for saying this, but, like making sure that we're getting enough cholesterol in our diet, right? Like all of these different various fats that we need to build our cell membranes are very, very important, and also, anti-inflammatory. As far as mitochondrial support, there's just so many different things. And, this is one of the reasons why I like to do a micronutrient panel and really look at all of the nutrients, look at what they're already getting adequate amounts of in their diet and in supplements, and really just addressing the things that are deficient. So I prefer to just do it in a more customized, individualized way, as opposed to just throwing all of the things that you would throw to support the mitochondria.
Awesome. I think that was a great response. Two more questions. I'm going to merge two into one, and then one final question for you. So the first is, are herbs safe to give to children? And then also, are they safe if you don't yet have a positive test result? Two separate questions, kind of the same thing. What is kind of the harm that, or is there harm that's potentially associated with these protocols?
So I will just answer generally. So generally, yes, the herbs are safe for children. I have treated children as young as a year old. I have treated babies through breastfeeding mothers. So I believe, yes, the herbs are very safe for children. Obviously, you would use a significantly reduced dose for children. And I do treat a lot of children. So I'm also a fellow with the Medical Academy of Pediatric Special Needs, and see, a lot of kids that have autism, pandas, underlying tick-borne disease, et cetera. And I use everything that I went over today, I would use with a child as well in a reduced dose. So are these herbs safe? For, there are contraindications, and I did list those on the slides for the 7 herbs that I did like the brief monograph with. So, I mean, it depends, right? So like Japanese knotweed and cat's claw are not safe for someone who is on a blood thinner to take, right? So there's these different caveats where, yes, generally speaking, if someone is not taking certain prescription medications, these herbs would be safe, whether you know or do not know if you have these infections. But I don't want to just say, yes, the herbs are safe, because it depends on what that person is also taking, because other medications could make them absolutely contraindicated.
I think that was a great answer, kind of covering all the bases. And realistically, like you said, you have a lot of experience in your practice to do all of this work. So you are a good person to speak to their efficacy on a variety of populations. The last question I have for you is, how often should you rotate your antimicrobials?
So I know that other doctors have differing opinions than me. What I will tell you is, as long as I see an improvement with my patient, I do not rotate. If things are working, we keep going. If a patient plateaus, then I will change things up. And I also like to start out, I'll say, kind of throwing the kitchen sink at it. And I will cut back as I go, so you might start out taking like 10 herbs for the first like 6 months, but in the end, you're down to only taking like 6 herbs, so I try to, because there's so much going on in the beginning, and the inflammation is so out of control, and the immune system is just so out of whack, right? And there's just so much damage, and the infectious loads are so big that it's like, once we kind of get the fire out and we're in more of like this rebuilding stage, we can reduce the amount of number or the amount of things that we're using, as long as we're still kind of like covering all of those bases. So I'm not sure if that answered the question or not.
I don't want to speak for Ms. Parks, but I believe yes, because obviously your specific experience is that you only do it as needed, which I think is a great approach. And, given that you are our expert presenter this evening, we don't need to address how some other doctors may do it. I believe that was really all of the questions that we have. And she said, yes, thank you. So great job.
Great.
So thank you so much, Mariah, for your help this evening, providing this really in-depth presentation. I will keep an eye out for the PDF version of your PowerPoint so that I can share it with everybody who's registered. Thank you all to our attendees for coming out on a Thursday evening to listen to Dr. Hinchey speak. I think, I don't want to speak for all of you, but I think there was a lot to be taken away from this presentation. And again, keep an eye out for the recording to come out tomorrow morning. So thank you.
Noah, would it be okay if I just quickly announce the LymeBytes Symposium?
Yes, definitely. And I can drop a link as well.
Great. So we are having the LymeBytes Symposium in Mystic, Connecticut on November 10th and 11th. It's a Friday and Saturday from about 8 a.m. to 5 p.m. And we are up to, I think we have 19 Lyme experts who are going to be there. And we are going to be talking about everything from PANS and PANDAS to autism and Alzheimer's, dementia, pediatric, psychiatric disorders, all of these different conditions that a lot of times Lyme and tick-borne illness, as well as mycotoxin illness, are some of these underlying causes too. We are going to be talking about proper diagnosis, so both from a clinical perspective as well as laboratory testing and accurate laboratory testing, to integrative treatment, to natural treatment, to detox and the importance of the microbiome, and just so much information. And it's appropriate for someone who is completely Lyme illiterate, and for doctors who have been, practicing and treating Lyme for decades. So, and hopefully it is going to be presented in a way that you can go back to work on Monday and implement a lot of what you have learned. So a lot of really useful information. We have tons of vendors. We have about 23 vendors who are industry experts sharing a lot of adjunctive treatment. We have labs, we have nutraceutical companies, Relax Far Infrared Sauna is going to be there. We have hyperbaric oxygen demonstration. A lot of really, really great things. And then also we are showcasing a lot of the nonprofit organizations that offer treatment grants to patients. So literally helping patients to pay for their testing and treatment, which is huge because this is really expensive.
Yeah, thank you so much, Dr. Hickney. I am unfortunately not going to be able to attend as we talked about, but everybody, I urge you to check it out. She's done some amazing presentations and really has got together a great group of people on this schedule. So try not to miss it if you can. And thank you again, and have a great rest of your evening, everybody.
Thanks, Noah.
All right. Bye-bye.